Hello everyone, and a very warm welcome to the first ever Kids Brain Health virtual conference. I'm Nikki Lewis, and I have the privilege to serve as the CEO for the network.
And my name is James Reynolds, and I'm the Chief Scientific Officer for the Kids Brain Health Network.
So we will begin with the 2020 conference by acknowledging the land on which we gather. It is the traditional unceded territory of the Salish coastal peoples. Of note, the Quatlan, the Katsi, the Semiahmoo, the Kikwatlan, the Kikite, and the Tawasan First Nations. We acknowledge their long-standing relationship with this unceded territory, and we pay respect to all Indigenous people in this region and from all regions across Canada. We acknowledge the traditional knowledge keepers, both young and old, and we honour the courageous leaders, both past, present and future.
We are pleased to be launching this virtual conference with our KBHN Board Chair, David Kuik, the Honourable Carla Qualtrough, Minister of Employment, Workforce Development and Disability Inclusion, the Honourable Senator Jim Munson, Elder Syexwaliya and Whonnock, a knowledge carrier elder from the Squamish Nation, and Professor Dugan O'Neill, Vice President of Research and International from the network's home institution, Simon Fraser University. Before we begin the day's events, we would like to invite Elder Syexwaliya to give a welcome.
KBHN, I welcome you to the unceded Coast Salish territories of all those in the lower mainland of British Columbia. I'm from Squamish Nation in lower mainland of Vancouver, and also Tsleil-Waututh and Musqueam, as well as SFU is on the unceded territories of the Coquitlam First Nation. So I welcome you to this Kids Brain Health, New and Emerging Ways of Connection today. And I'm going to do my ancestors' song, Syexwaliya song, and say a quick prayer and get you focused for the day. And I'd like to also share with you that our old people believe it's important. My grandfather taught me to be in Chomo and Squalwan, one heart and one mind, to Chen Dwight, stand and work together to support each other, help each other, hold each other up in a good way. And he also taught me that you need to have Whonnock's respect for each other's spiritual ways. And he said that you can't be like this or this or this. And while I sing and do the prayer, I just ask you to keep your hands open and maybe to help you relax. Take a couple breaths. That's why I go. And get grounded. And while I sing, please pray for your family and friends, especially during this these hard times of the COVID that's in the country and world, to just pray for all your family and friends. Chenquementomi kakakanik chasiam, yonsion so tenoyap and manman to squals to seats, yonsio manman snachum, yonsio manman say top to squals to seats. In English, I'll now share what I just said in my Squamish language. We're grateful and thankful to you, Creator, to watch over and protect each and every one of your children gathered here today, and also their family and friends, to help them with their swallowing, their feelings in their heart, and their mental, emotional, physical, spiritual well-being. Asking you, Creator, to help with the words that we're going to hear today. We'll hear the words, take into our hearts what's meant for us, set aside what you don't need right now, and maybe bring it back on another day. And to be able to speak and share those words in a good way, respectful way, Whonnock, and to transfer knowledge to each other. And asking you, Creator, to let today's work, work be Whonnock, excellent, bringing us together to Chen Dwight, stand and work together to hold each other up, support one another, help each other, to be able to help the children, the Munmun, that we're all gathering for. Asking you, Creator, to hear our prayers for all our family and friends who have serious illnesses and injuries and are waiting for treatments or surgery for their health, healing, and recovery. Right now, in a lot of places, fentanyl opioid crisis is really bad. And we ask you, Creator, to hear our prayers for all our family and friends who may have traumas and are battling alcohol and drugs, and those incarcerated because of that battle, to find the healing path to recovery and maybe help others not walk that dark path. And prayers for all their family and friends who worry about them and don't want to lose them. Asking special prayers for all of the Munmun, the children who need our help and are needing to be given the tools and supports that they need. Help all the presenters today to be able to share their knowledge and transfer it to those who need those words to be heard. Tama Kwetsi Snachum, those are my words. Wachayap yo, you all take care.
Thank you, Elder Sequalia, for that wonderful opening, that traditional opening, and heartfelt words and prayers. Up next, I'd like to introduce you to someone whose commitment to addressing inequality and championing diversity makes her a strong voice in government. She's the former Minister of Sport and Persons with Disabilities and the former Minister of Public Services and Procurement and Accessibility. She now serves as the Minister of Employment, Workforce Development and Disability Inclusion. Please welcome to the virtual stage the Honourable Carla Qualtrough. Minister Qualtrough is a former Paralympic athlete, a human rights lawyer, and the 2012 recipient of the Queen Elizabeth Diamond Jubilee Medal. As the Minister of Employment, Workforce Development and Disability Inclusion, Qualtrough has been one of the leaders in the development of the Accessible Canada Act. The Accessible Canada Act is federal legislation, and she hopes will make the country a model of accessibility and inclusion for the world. Please join me in hearing a message from the Honourable Carla Qualtrough.
Good day, everyone. It's my great pleasure to welcome you today to the Kids Brain Health Network annual virtual conference. This year's theme of new and emerging ways of connecting has never been more relevant. En tant que ministre de l'Emploi, du Développement de la Main-d'œuvre et de l'Inclusion des personnes handicapées, et en tant moi-même une personne en situation de handicap, je suis fière que notre gouvernement adapte une vision qui tient compte du point de vue des personnes en situation de handicap dans ses processus décisionnels. I strongly believe in an accessible, barrier-free Canada where all Canadians have the same opportunities to participate fully in the workforce and in society. We know that persons with disabilities have faced unique and heightened challenges since the start of this pandemic. The progress we made over the last few years in disability inclusion and accessibility in Canada, particularly the adoption of the Accessible Canada Act, allowed us to be better prepared for this pandemic. When the world was hit by the biggest global public health crisis in generations, we had the tools in place to ensure a disability-inclusive emergency response. The Act has been guiding our government's pandemic response, ensuring Canadians with disabilities' unique needs and challenges have been incorporated. We put in place a number of measures to support Canadians with disabilities, including support for workers with disabilities, as well as a one-time payment of $600 to help with increased expenses. Nous avons également un plan d'avenir afin de reconstruire sur de meilleures bases. On September 23rd, our government laid out our vision for a stronger and more resilient Canada in the speech from the throne, and we committed to bringing forward the first ever disability inclusion plan. This plan includes a new Canada Disability Benefit and a robust employment strategy for Canadians with disabilities that emphasizes the economic benefits of disability inclusion, focusing on training, employment supports, and barrier removal. Finally, we will develop a new inclusive process to determine eligibility for federal government disability programs and benefits, one that reflects a modern understanding of disability. Nous continuerons également à travailler de près avec nos partenaires fédéraux, provinciaux et territoriaux et les principaux intervenants afin d'élaborer une stratégie nationale sur l'autisme. Nous nous efforçons chaque jour de faire avancer ces mesures. Je suis très enthousiaste à l'idée de faire avancer les choses afin d'obtenir des résultats aujourd'hui et de garantir un avenir meilleur. As always, I will continue working closely with the disability community in the spirit of nothing without us. I want to thank each and every one of you for the work you do every day to develop innovative solutions and services to improve the lives of children living with neurodevelopmental disabilities and their families. Have a great conference. Thank you. Merci.
Thank you, Minister Qualtrough, for that powerful message. For those of you just joining us, welcome to the first ever Kids Brain Health virtual conference. That was the Honorable Carla Qualtrough, Minister of Employment, Workforce Development, and Disability Inclusion, with a video greeting for all of you, our conference delegates. I want to thank Minister Qualtrough for her inspiring remarks and introduce our next speaker, the Honorable Senator Jim Munson. The Honorable Senator Jim Munson is a member of the Standing Senate Committee on Social Affairs, Science, and Technology, and a passionate advocate for individuals with neurodevelopmental disabilities. Among many other achievements, his advocacy has led to an act respecting World Autism Awareness Day and the report, Pay Now or Pay Later, Autism Families in Crisis. Senator Munson has also sent a video greeting for everyone at the conference.
Well, thanks very much, and hi, everyone. I feel so much at home today and thinking of my NeuroDevNet days and now the Kids Brain Health Network. There is a saying that you can seek the wisdom of the ages, but always look at the world through the eyes of a child. There's also another saying that timing is everything in life. It is wonderful to share the same stage with Carla Qualtrough. I have known Minister Qualtrough, as my old boss, Jean Chrétien, would say, since a long time, long before she was an MP or minister. That's because Carla has been a partner and leader in the accessibility community since a long time. So when she asked me to sponsor in the Senate a couple of years ago the Accessible Canada Act, I was pleased to accept, not only because I believe in an accessible Canada, but also because I believe in Carla. Furthermore, I'm encouraged by her leadership and support for a national autism strategy since becoming minister. This is an important step forward. Every step is a good one. Teamwork has Canada on the right track towards a national autism strategy. And thank you for your leadership, Minister. Another important part of that team is Connie Putterman. There are so many people to talk about who will be speaking at this conference, but I thought I would give a shout out to Connie. She's a champion in the autism community and has been at this for over 20 years. Her dedication and perseverance are inspiring to me, and I know many of us are looking forward to listening and learning from her this week. The reason we are all here today is children. I've devoted my 17 years in the Senate to children. Now I only have 8 months to go, so I have to retire according to the Constitution by the age of 75, but I must find more work to do, and I can look no further than former Senator Landon Pearson, who will soon turn 90, and I recognize I still have a future. But thank you, Kids Brain Health Network, for bringing us together this week so that we can work together for the inclusion of children living with neurodevelopmental disabilities in all aspects of Canadian society. We come together to find ways to improve their well-being, quality of life, and to measurably improve outcomes for them and their families. The work you are doing here is important. Work on evidence-based interventions, early identification, and enhanced family support. Now more than ever, it's time to put your findings into practice. Little history, 2007, a Senate report called Children, the Silent Citizens, which focused on Canada's commitment to children. The report identified many deficiencies in our system. Children's voices rarely inform government decisions, yet they are one of the groups most affected by government action or inaction. Children are not merely underrepresented, they are almost not represented at all. That is why your work, the Kids Brain Health Network, is so important. We must include the voices of children, including children with disabilities, in our policy making to give them a real chance to reach their full potential. It helps them to inform better government decisions and outcomes for our children. That brings me to today's reality check, COVID-19. Yes, it has a dramatic effect. The COVID-19, the pandemic, a dramatic effect on all of our routines. But this is especially true for children. The Kids Brain Health Network conference theme for this year, as you know, is fittingly new and emerging ways of connecting. 2020 has certainly made a shift the way we do business with our family, friends, sports, everything, and has raised many challenges in access to health, mental health, and many other services they rely on. Now, while the pandemic has created several barriers which need our attention, for example, basic service needs, I'd like to focus on something a bit more positive and challenging people with disabilities, children with disabilities. All of us are in this business together. I always like to look at the positive side of life. And that inspiration comes from a young man who works for me. My Senate office assistant, Michael Trink, lives with Down syndrome. And while we all miss our weekly lunch together and working time together, connecting remotely has helped him to gain new friends, stay healthier, and gaining a new expertise, all from his own Senate-approved computer. And Michael knows how to use new technology. Michael was born to Zoom or use any other new connecting technology. Programs and work meetings moving to online means a lot less planning for Michael. The shift means no travel time or arranging transportation. Michael has noticed that he is less tired at the end of the day. His immune system is healthier, so he gets sick less. Barriers to participating have come down for him as connecting online becomes more mainstream and accepted. Perhaps this is an unexpected advantage for people working with a disability. Furthermore, the positive effect has reached to Michael's personal life. He's made many new friends and acquaintances all during this pandemic, and he's been able to stay in touch with them as often as he likes without the hassles of finding transportation or becoming too exhausted. He's turned a challenging situation into a positive one, which isn't surprising knowing Michael and his optimistic nature. In closing, I finally want to give everyone a piece of advice from Michael, which has given me motivation to endure the stresses of the pandemic. I think it is good advice for all of us to use during this conference. In Michael's words, stay positive and keep moving forward. For all of us who are so engaged with the Kids Brain Health Network, stay positive and keep moving forward. Thank you.
A big thank you to Senator Munson for the thoughts that he so generously shared, and which help us set the stage for the presentations and discussion that will occur at the conference. I'm especially grateful for the emphasis he put on children's voices not being heard, as we've heard this from many of our families from across Canada. Now, I'd like to introduce our board chair, David Kuik, to speak. David has been part of Kids Brain Health Board since 2017 and is passionate about children with neurodevelopmental disabilities and finding solutions. David has consistently worked with organisations that leverage innovative technology to promote positive change in many lives. Kids Brain Health Network is no exception, and I welcome David Kuik to speak.
Thank you very much, Nikki, and James as well for your opening remarks. A special thank you to Elder Syexwaliya, open hands and one heart, one mind, powerful message. I think that's the right way to start, and I'm grateful for those words. Special thank you as well to the Honorable Minister Carla Qualtrough for taking the time to bring us your speech. We know how busy you are and we appreciate your time. Additionally, thank you to Honorable Senator Jim Munson for bringing your remarks. To have both houses of our government presented at the opening session is gratifying to see, and we thank you for your support. My name is David Kuik. I describe myself in several ways. So I call myself a computer scientist, I'm an entrepreneur, I'm a CEO, and I'm the board chair for Kids Brain Health Network. Those are all descriptions I'm grateful for and I'm proud of. But there's another title I use to describe myself, the husband of Tracy and the father of 3 children. My youngest daughter, three girls I should say. My youngest daughter is Paige, she's 17 and she's severely autistic. And she's our personal connection to Kids Brain Health Network as a family. She's the reason for us why this mission matters so much and why I'm so excited and honored to be part of this board. Over the past many years, my family has worked with a lot of people, doctors, teachers, therapists, specialists, a tremendous number of people who've been helping us to help Paige live her fullest life. We call that group of people Team Paige. And for me, Kids Brain Health Network is Canada's Team Paige. If you think about it, between 14 and 17% of our children between the ages of 4 and 14 have some kind of neurodevelopmental disability and are going to face some barriers throughout their lives. This is why our KBHN's mission for identifying earlier diagnosis, providing evidence-based interventions, and support for families is so important. And over the past 10 years, we've been doing some monumental work. This year marks our 10th anniversary, and we have some highlights from those past 10 years. Over 100 NCE-funded investigators and 260 affiliated researchers have been working hard on our mission. And together they have produced over 83 research innovation deliverables, including commercial products, practice guidelines, and training packages, and close to 400 NCE-supported publications. And as you know, publications are the bedrock of good science. Achieving those key performance indicators is a testament to our hard work, commitment, and dedication to our vision. But this is really only the start. Earlier this year, we were pleased to learn that we'd been awarded an additional $11.7 million by the NCE for our Cycle 3. Now, due to the pandemic, this 3-year award has been extended to 4 years. So we have 4 years to continue to work on that mission of early diagnosis, evidence-based interventions, and support for families. And the next 4 years, it's all about impact. We need to take the foundation of what we've been building for the past 10 years and help deliver it, implement it in practice at the front line for our families and our children. Now, this is my 4th KBHN conference, as Nikki said, and I'm excited about it. The previous 3 have been jam-packed, energy-filled, inspirational opportunities for me personally, and I can tell from conference attendees in the past, for everyone to engage and learn and interact and provide new energy for the year ahead. Now this year it's a little bit different. It's our first virtual conference, but I'm excited about this as well. And I want to take a moment to thank our organizing committee for putting together an amazing agenda. So many great speakers, so many great topics, lots of opportunities to collaborate and learn. Additionally, thank you to our corporate sponsors for your generous support. Without you, we couldn't pull off an event like this. And finally, thank you to all of you for participating. Your energy and enthusiasm is vital to make this a success. Please use the chat forums, ask questions, engage on our platform. Let's bring the same energy to this virtual conference as we've done in the past in-person conferences. Thank you all. James, I'll hand it back to you.
There we go. My apologies. I forgot the conference virtual etiquette of turning my microphone back on. I wanted to thank David for that overview of the network, its activities, and of course, the conference. And I want to take this opportunity to thank our host institution, Simon Fraser University. Their conference sponsorship and continued support for KBHN's initiatives are invaluable. And I will now call on SFU's Vice President, Research and International, Dugan O'Neill, to say a few words.
Good morning, everyone. My name is Dugan O'Neill, and I'm the Vice President, Research and International Pro Tem at Simon Fraser University. It's my great pleasure to welcome you all to the first ever Kids Brain Health virtual conference. And I'd like to start by giving thanks to the organizing committee for putting together this virtual event, despite the difficulties the world is facing. Innovative responses to the pandemic, like this one, have been key to the continuance of research and are critical in moving forward. Conducting and mobilizing research for the betterment of society is one of the main functions of universities. And I'm proud of the tremendous depth, breadth, and impact of SFU researchers and of our partners and our partnerships. Our partnership with Kids Brain Health Network embodies SFU's commitment to engage with communities, organizations, and partners to advance knowledge that improves the lives of people and generates real change. SFU is investing and building on our considerable expertise in brain imaging, neurodiagnostics, technology development, and social behavioral research. We've invested in several assets in the area of neuroscience and are proud to host the Kids Brain Health Network at our SFU Surrey campus. With collaborative efforts through this partnership, we're committed to providing healthcare professionals, policymakers, caregivers, and families with tools and information to promote earlier identification, better treatment, and optimal outcomes for children and youth today and in the future. I want to finish my remarks with thanks to Nikki Lewis and James Reynolds and the talented team at Kids Brain Health Network for all their hard work putting together this conference, and to thank you all for joining us this week.
Thanks, Dugan. The investment in KBHN by the Networks of Centers of Excellence program over a decade ago created a national interdisciplinary research network that focused on developing innovative solutions for children with neurodevelopmental disabilities and their families. Our vision is that all children living with neurodevelopmental disabilities will enjoy quality of life, inclusion in all aspects of society, and reach their full potential. Like previous years, the conference allows us to bring the neurodevelopmental community together to discuss new ideas, identify the knowledge gaps, and work collectively towards improving outcomes for children and families. This year's conference theme, New and Emerging Ways of Connecting, will focus on the increased difficulties in accessing supports from a home base and the challenges faced by both families and service providers during the COVID-19 pandemic. The conference will also profile innovative solutions and the vital role of technology, innovation, and policy decision-making to address the challenges faced by children with neurodevelopmental disabilities and their families. Over the next few days, you will hear from our researchers, trainees, partners, parents, and family members regarding how we are all working together to address these challenges. Our programming and logistics committees have done an amazing job to bring you a conference jam-packed with exciting sessions and interactive events. We hope that these stories will not only inform and inspire you, but also serve as a reminder of all that remains to be accomplished. We are grateful for your attendance, participation, and continued engagement today and throughout the week. We look forward to learning with you and from all of you. But more importantly, we're excited to share this journey with you.
Thank you, James, and thank you to all our dignitaries this morning for all of your messages and support to the conference. And now, without further ado, I'd like to introduce somebody who's going to guide us through the next 4 days, a man that needs little introduction. He's a veteran emergency physician at Mount Sinai Hospital, the author of several best-selling books, and the host of CBC's award-winning radio show, White Coat, Black Art. With him, we will explore how research practices have changed since the start of the pandemic and address specific challenges that children with neurodevelopmental disabilities and families now face. It's my pleasure now to announce our Master of Ceremony for this conference, which is no other than Dr. Brian Goldman. Thank you.
Thank you. Thank you, Nikki, James, David, Dugan, Elder Sequalia, and Whonnock, and of course the Honorable Minister Carla Qualtrough, Senator Jim Munson, for that warm welcome.